Hello, I'm Cindy with Wisconsin Voices for Recovery, and this is Speak Out on Stigma. Today we'll be hearing from Dr. Bobby Redwood, emergency physician and physician improvement advisor for the Wisconsin Hospital Association. Hi, Dr. Redwood, how are you today?
I'm doing well, Cindy. Thanks for having me.
Good, glad that you're here. So tell me, what do you think makes people use stigmatizing language?
Wow, that's the key question, isn't it? Well, I mean, from a societal perspective, it's everywhere, right? In the movies we watch, the TV shows we see. I remember as a kid watching Cops, which is basically law enforcement chasing after black and brown people who are using substances. Just a terrible programming, terrible way to view the world. And it was on television every single night. Now, in terms of my current professional life, I work in healthcare. I'm in the emergency department, and I do unfortunately sometimes hear stigmatizing language used among my colleagues. It's actually rare that I hear it used with malicious intent. More commonly, someone's making an attempt at gallows humor or is simply using an outdated term, and they're not really aware that it conveys stigma onto people who use drugs.
And what can be done to address stigma in the community systemically and within the structures that people with substance use disorders encounter?
Yeah, totally. If I can build on my last answer, I'll give you an example of both ways that I see stigmatizing language used in the emergency department and how I address this language in my provider community, but also as a system. So I was on shift one time, and a provider, one of my colleagues, commented that a patient's urine drug screen was quote unquote lit up like a Christmas tree. And everyone heard that and kind of chuckled around him, and it seemed like this lighthearted, funny moment. It didn't sit well with me. The phrasing brings this image of festivities, colored lights, good times, when in fact it's describing a test that shows the extent of someone's substance use disorder and the suffering associated with the use of those drugs. I put myself out there after the shift. I took the provider aside and we had a frank discussion about the importance of using scientific language to discuss a positive or negative urine drug screen. And he reflected on the comments thoughtfully, apologized for being glib, and told me that he would drop the quote unquote joke from his lexicon. So we have a stressful job in the emergency department. I think that this private provider didn't really realize that his attempt at humor was being made at the expense of the patient. And honestly, I think we both grew as providers that day. Me for speaking out against stigma, and him for gracefully and purposefully responding to the feedback. And our friendship was stronger because of it. When you can have that mutual respect and talk to people openly, it makes us better doctors. Now, another example is one I hear all the time. Providers and nurses will say that someone who has been abstaining from drugs has been quote unquote clean. So they'll say he's been clean for 8 months. Of course, when someone has a lapse or is using drugs again, use of the word clean would imply that now they are dirty, right? Quote unquote dirty, as in a dirty urine drug screen. And this is just so obviously counterproductive since we need patients to seek care the most when they've had a lapse or are using again. And so we want them to feel welcome. We don't want them to feel dirty, like they can't come into our healthcare environment. And so I always take care to educate my colleagues that a better phrasing is simply, this patient has not used drugs in 8 months. Systemically in healthcare, of course, we write policies against the use of stigmatizing language. We encourage our staff to be part of the solution by taking action, like assigning the Shine a Light on Stigma pledge. That's a pledge that gets it in writing that you will avoid using stigmatizing language and encourage others to do the same. We also post signage around the ED. This is a stigma-free environment. All are welcome to seek care here. We want everyone to feel comfortable seeking healthcare, whether it's for diabetes, hypertension, or substance use disorders.
Thank you so much for sharing. It sounds like really good, great examples of what you're doing to speak out against stigma, and improve the environments that you're in. So thank you for that. Is there anything else you'd like to add?
If I can give a personal plug, I run the naloxone project. It's an effort to distribute naloxone directly from the emergency department. And in Wisconsin, we're pretty good at doing this. But if anybody is watching this and has an opportunity to connect me with an emergency department that could be directly distributing free naloxone, that is something that we're always looking forward to. And so I can be connected through the Wisconsin Voices of Recovery, but we're trying to get naloxone out there. So I call it the EpiPen for opioid overdose, and really think that we should all, as healthcare providers or people who use drugs or people who love someone who uses drugs, be carrying naloxone on our person in case we do encounter that unfortunate situation.
Thank you so much, Dr. Redwood, for sharing your views on stigma, and thank you to our viewers for watching. Speak Out on Stigma is a forum to raise awareness about the harmful impact of stigma on those in and seeking recovery. Recovery is for everyone. Together we can eliminate stigma. Don't forget to like, comment, and share this video. Thank you and have a good day.